Good. It's nice to see you again.
Nice to see you too.
What brings you to see me today?
I'm having a headache. It's really bad.
That is not fun. How long have you had this headache?
I've had it for about an hour.
Okay. And where do you feel the pain? Is it in the front, in the back?
It's mostly behind my right eye, kind of in the front.
Okay. And you said you've only been feeling this for the last hour?
Yeah, but I've gotten these before.
Okay. How many times before?
Times over the past year.
Okay. And how would you describe the pain? Is it sharp or dull or achy?
It's kind of throbbing
Okay.
and light and loud noises like make it a lot worse.
Okay. And is it presenting the same this time as it did in the past?
Mhm.
Okay. And does it stay in the one spot, or is it sort of going all over your head?
No, it's just in that one spot.
Okay. And when you had it in the past, how long did it last?
About an hour to like it would sometimes just last all day.
Okay. All right. And have you taken any medication to try to help it feel better?
I have Excedrin for migraines, but it doesn't help. I've tried to take it before for these and anything.
All right. I'm just going to go through a couple of health history questions to try to get a bigger picture of your overall health. And then after that, we'll do some physical assessments to see if we can narrow in on what the trouble is, okay?
Okay.
Are you currently taking any kind of medications?
I am. I'm taking Toprol XL.
Okay, and what's the dosage of that?
50 milligrams a day.
And how long have you been taking that medication?
Well, I've had high blood pressure for about 10 years, so.
Okay.
About 10 years.
And is that medication, is it controlling your blood pressure well for you?
Yes, I had a checkup about 2 months ago when my blood pressure was 122/72.
Okay. It's a little bit higher than that today, but a lot of times when you're in pain, that can make your blood pressure go up. So that's sort of something I would almost expect. Any other medications that you're currently taking?
No.
Are you taking any over-the-counter medications? No. Any herbal supplements at all?
No.
No. Do you have any allergies to any medications?
No.
Any allergies to any foods?
No.
Any allergies to anything environmental, like dust, pollen, animals? Let's see. Any family history of migraines?
My mom had problems with headaches, and she actually died from brain cancer when she was 68.
Any health trouble with your dad at all?
No.
Grandparents, any health history with them? No. Any brothers or
No,
sisters?
I don't know anything about them really.
Any brothers or sisters of yours with any health trouble?
No.
No. Do you drink any alcohol?
No.
Have you ever been a smoker?
No.
Do you have any history of asthma? Have you ever had any surgeries in the past?
No.
Do you have any history of frequent ear infections or earaches?
No.
Any history of frequent sinus infections?
Mm-mm. No, ma'am.
Any surgery? You said you have had no previous surgeries?
No, ma'am.
Okay. Have you had any feelings of weakness or feeling like really lethargic lately?
No. Other than these headaches, I feel like I'm pretty normal.
Okay.
Not really having any of those kinds of problems.
Have you noticed your temperature was a little bit elevated today? Have you noticed that you had a fever or chills or sweats?
That's not really been a problem.
No. Any changes in your weight recently?
No.
Any changes in your vision?
No, other than like when these headaches start, like I'll see flashes of light. And like I said, like the light really bothers my eyes right now.
Okay.
But other than that, like I don't.
Any redness or itching or drainage in your eyes? No. Any pain in your ears at all?
No.
Any dizziness?
Right when the headache starts, I feel dizzy.
Okay.
Yeah. Like I was feeling dizzy before it started.
Okay. Any trouble with nasal congestion or drainage?
No, ma'am.
Any history of bloody noses?
No.
Any itching or sneezing or coughing?
No.
Any pain in your sinuses?
It's all pretty much right behind my eye
Okay.
and over my right eye, like right in here.
Okay. Well, it sounds like you might be suffering from a migraine headache, but with your family history of your mom with brain cancer, just to be sure, we'll probably get some scans to rule that out. Is that it? We don't do any physical assessment, right?
I don't think so. I think you just asked me questions about it.
All right. Did I miss anything?
I think the one thing that they said, like, that you didn't ask about was that, like, I'm not supposed to be able to eat because I feel nauseous.
Oh. Okay.
But
All right.
nauseous and like I just don't even want to eat. So yeah, you think these are just migraines for now, though? You don't see anything else concerning?
It sounds like pretty classic migraine symptoms
Okay.
that
Well, that's reassuring.
and you've had these same symptoms in the past too, so that sort of is showing us there's a pattern there.
Yep. I've had them probably once or twice a month over the past 6 months, and I can't go to work or anything when I have them. I just can't function. It's pretty miserable.
So there are prescription medications that we can use to help with the migraines.
Okay.
So we will try you on one of those and see if that's helpful. But at the same time, we'll order some scans just to be on the safe side.
Okay. That sounds good.
So we can start you on the medication. We will get the scans ordered and scheduled, and then I'd like to see you back in a week just to follow up, okay?
Okay. That sounds good. Thank you.
You're welcome. It's nice to see you today.
Good to see you too.
All right. Woo-hoo. Your turn.
Cool. I'm gonna grab my pen real quick because I wanna write stuff down. Just a second.
Okay.
Okay, great. Oh, my name's Emily. I'm the nurse practitioner that's gonna take care of you today. What's going on?
My stomach keeps hurting.
When did that start?
Well, I've had issues like this for quite a while. I think I've been having it since I was about 18.
Oh, really? Have you seen a doctor for it before?
No, because it never really lasted very long. It was just sort of sporadic, but this time it feels worse.
Oh, really?
Yeah.
Where is it? In your belly.
Um, it's in my lower belly.
Is it on one side or kind of in the middle? Or all over in your lower belly?
It's just all over.
In your lower belly.
Yeah.
What's worse today than for, like you said, it's happened before, but what's different today?
Well, over the last year, it seems like it's been happening more frequently. And then probably over the last 6 months, it's been happening about once a week. So it seems just like it's getting more frequent, and so that's what worried me. That's why I came in.
Okay. Do you have any other medical problems?
No.
You've not had any other problems besides this pain in your belly? Are you allergic to anything?
No.
Any medicines every day?
No, I don't take anything. I'm pretty healthy otherwise.
Even like any over-the-counter vitamins or anything like that?
No, I know I should probably take a multivitamin, but I just don't.
Okay. Have you had any family history of any kind of medical problems?
No, my parents both died when they were old.
Okay. Any nausea or vomiting with this pain?
A lot of times I'll feel bloated, and it's especially worse after I eat.
Do you feel like the feeling that you're bloated is associated with pain? Like, do those things happen at the same time?
Yeah, it seems like it's worse after I eat.
So the feelings of being bloated and the pain are worse after you eat.
Mhm.
Of your bowel movements then?
Well, those are sort of iffy. I usually go at least once a day, but um, then sometimes I'll go more than that, and it can be almost like I have diarrhea. But it's not
So you'll
anything.
kind of have. Do you
Not
feel
anything.
like I'm sorry, can you say that again? About your bowel movements where you said you feel like they're loose, like diarrhea sometimes?
Yeah, sometimes, but not every day. I usually go at least once a day, but then some days it seems like something sets me off, and I'll go 2 or 3 times. And when I'm having that diarrhea type stuff is when I feel all bloated.
Okay. Tell me more about the diarrhea. What's it like? Is it like watery or is it loose? Bowel movement color or is it a different color?
I wouldn't say, I don't know if it's diarrhea. It's just more, I would say, loose.
You're not seeing any blood in that stool at all?
No.
Okay, that's good. Have you tried anything to treat the loose stool if you're not really, have you
No.
tried any medicines for it at all?
No.
No, okay. Um, I'll ask you just a couple of like background questions, kind of get more information about you. Do you feel like you're safe in your home environment?
Yes.
Okay,
I just
say
live
that
by
again?
myself.
You live by yourself?
Mhm.
Okay. How do you feel like things have been going, generally speaking, as far as your stress levels and how's work and life going for you, do you feel like?
I feel good. Um, I like my job. I've been there a while. It doesn't
Okay,
really make me stressed.
okay. And do you use tobacco?
No.
Do you drink any alcohol? And do you
Um,
use, hmm? I'm sorry.
Sometimes I'll have a glass of wine after dinner.
Um, and do you use any street drugs or marijuana or anything like that?
Mm-mm.
Um, have you had any surgeries before?
I did have my appendix out when I was 10.
Okay. And you have your gallbladder still? You've never had any problems with your belly before that you've had a doctor talk to you about, like you've never had pancreatitis or flux or anything like that before?
Nope.
Okay. And you said you don't take any medicine. Okay. Have you had any urinary tract problems at all that you can think of? You don't feel like you're feeling like you have to go more than usual, or that it hurts when you
No.
pee, or anything like that? And when was your last menstrual?
I get that regularly, every month.
Okay. And if, on a scale of 0 to 10, how bad is this pain for you right now?
Well, I'm not having any pain right now, but when it does come, I'd say it's a 5.
A 5 out of 10, you think? And how would you describe the pain? Would you, like, what are some words you would think of that would go along with it? Like, is it cramping? You said bloated. Are there any other?
Yeah, and it seems like I have cramping right before I have the loose stool.
Okay. And how is the rest of your health? Have you had any problems with chest pain or shortness of breath or coughing or anything like that? Okay. Is there anything that I haven't asked you about that you feel is important about what's going on?
I've tried to see if it gets worse with certain things that I eat, but I've tried changing my diet. I've tried cutting milk out, and that didn't make a difference. I tried not eating foods, and that didn't make a difference. I tried not having any alcohol and no processed meats, and none of that made any difference.
Okay. All right. And just one more question. How many times a week do you feel like you have this loose stool that's different than your normal bowel movement?
I'd say about 2 days out of a week, I'll have trouble with it.
Okay. All right. Do you feel like, is there anything else that matters to you today that I've not talked to you about yet? I feel like we've touched on all the important parts so far.
I think so.
Okay. Well, now that I've got this history from you, I think we'll test and probably another and maybe an X-ray, and there's a chance that we may end up doing a CT scan of your belly and getting a stool sample to check your belly. You haven't. One more question. To anywhere that I feel like may have been a place that didn't have a good water supply at all, or have you gone swimming in any rivers or?
No.
No. Okay. So you've mostly just been at home here. Okay. Well, yeah, as far as our plan from here on out, I think that's what we'll need to do, okay?
Okay.
Do you have any questions for me?
So you'll just call me with the results?
Yes, absolutely. I think we'll probably actually have you come in next week, those results, and before you leave, we'll set up the specimen collection for a stool sample. So I can give you directions for that. All right. I'm going to stop the broadcast now.
Okay.